Today, I'll be telling you 5 danger signs of period you should look out for. If you're new to my channel, I am Dr. Amarachi Ijeoma. I am a fertility physician and my channel focuses on everything women's health and infertility. So if this is the kind of content you're interested in, keep watching. Number 1, if the days between your period are less than 21 days. This simply means that if you see your period today, that is, you see your period blood today and you bleed today, tomorrow, next tomorrow, and the day after that, which is 4 days, then before you see your next period, it's not even up to 21 days. This is called your cycle length. The number of days between the first day you see your period and the last day before you see your next period. If you calculate this number of days and it is not up to 21 days, then it could be a danger sign. Women who have cycle lengths less than 21 days find it challenging to get pregnant, but it is still possible for them to get pregnant. Because of the very short cycle length, ovulation occurs sooner than expected. It can be irregular, varying from month to month, so it is very difficult to track ovulation for women with less than 21 days cycle. This is why it is challenging for them to get pregnant. It's not like they cannot, it's difficult for them to track their ovulation, so it makes it challenging to know when to have sexual intercourse in order to get pregnant. In situations like this, ovulation strips can help. So you can just go to a pharmacy, buy ovulation strips, and then be monitoring your cycle so that you can know when you're ovulating. Another challenge that women with cycle length of less than 21 days face is that the period between when they ovulate to their next bleeding is too short for fertilization and then implantation to occur. The things that can cause your cycle length to be less than 21 days include stress, sexually transmitted infections like gonorrhea, chlamydia, and then perimenopause. If you're about to reach menopause, the months to years very close to menopause can actually cause you to have a cycle length less than 21 days. In some women, having a cycle length less than 21 days is normal. That's their normal cycle length. That is their own normal, meaning that there's no abnormality. It's their normal cycle length. The second danger sign to look out for is cycle length greater than 35 days. That is, if the days in between your period is greater than 35 days. So in other words, you're seeing only few periods every year, about 4 to 9 periods in a year. For some people, even less than 4 periods in a year. There are many medical conditions, gynecological conditions that can cause this. The most common being PCOS, polycystic ovarian syndrome. PCOS is caused by imbalance of your female hormones that will cause several small cysts to be on your ovaries and excess production of the male hormone in your body. Getting pregnant with PCOS is also challenging, but it is possible to get pregnant with PCOS. The challenge women with PCOS have with getting pregnant is the inability to predict ovulation because they don't ovulate every month. In a year, they might ovulate only 4 times. So it's difficult to predict it. Women with normal cycle length should ovulate every month, and this gives them a higher chance of getting pregnant. But women with PCOS that have only 5 times in a year where they're ovulating and they can't even know when exactly they'll be ovulating because they can't predict it. This is the challenge they have with getting pregnant. It doesn't mean they can't, it's just they have a challenge. Getting pregnant for them might be delayed. If you're having a cycle length greater than 35 days, it's a danger sign. You need to get evaluated. You will need to see your doctor. The third danger sign to look out for is periods lasting more than 7 days. If your periods last more than 7 days, that is, if you're actively bleeding for more than 7 days, it's a danger sign. Periods more than 7 days is called long period. And you can see this in early puberty. That is when you first start to see your period, or you're on birth control pills. This could cause your periods to be longer than 7 days. Or you're perimenopausal, that is, you're about to reach menopause. It can be more than 7 days. Another cause for long period, which is a very common cause, is uterine fibroid. Fibroids can cause your periods to be very heavy and to last longer than 7 days. So if you notice that your periods are suddenly heavier than it used to be before, that's a red flag, because fibroid can get complicated with infertility and anemia. Anemia is simply low blood levels. And when you have low blood levels, you can feel dizzy every month when you're on your period. You can have iron deficiency. Depending on the severity of the blood loss, you might even be hearing your heart pounding. You can be hearing your heart beat. It is important to note that a lot of women have fibroids. Fibroids is very common in women of reproductive age. And a lot of women go on to live healthy lives without having to operate on the fibroid or do anything about the fibroid. This is because most times fibroids do not have symptoms. They do not come with symptoms. They are asymptomatic. It only gets symptomatic when it becomes complicated. Maybe the size is bigger or a part of it starts to lose its blood supply. That's when we become concerned about fibroids. So once you notice any changes in your period, like heavier periods or longer days of bleeding, it is a red flag and you should see your doctor. Or it suddenly started lasting longer days than you used to bleed before, that's a red flag. Also, still on number 3, if you notice that your bleeding is lasting for less than 2 days, this is a red flag, because it could also mean that you're pregnant, because you could just be having implantation bleeding, or it could mean that you're having a miscarriage. Sometimes when women are having a miscarriage, they could mistake it for period blood. Yeah, a lot of women having miscarriage don't know they're having a miscarriage because in the first place, they didn't even know that they were pregnant. So by the time it's time to see their next period and they're having a miscarriage, they will just assume it is period blood. So if you notice that your period blood is lasting for less than 2 days, then it's a danger sign. Also, for women on birth control pills, they can notice bleeding for less than 2 days. The fourth danger sign is extremely painful period, unbearable. You're not able to go about your daily activities because of this pain. It's limiting you from doing anything because of this pain. Or sometimes the pain, you're even feeling the pain on your inner thighs. Sometimes you're feeling the pain on your lower back. You're having nausea, you're even vomiting. You've gone to your neighborhood pharmacy to buy the strongest one that they can sell to you without prescription, and you've taken it and there's no relief. This is a danger sign. You don't necessarily have to have everything in one. You can just have like very unbearable pain. It's still a danger sign. Then you have it's back pain or any of the other things that I have mentioned, it's a danger sign. Then you have all of what I've mentioned, it's a danger sign. A number of gynecological conditions could cause this, especially endometriosis. Endometriosis is a major cause of infertility, with period pain being the most commonest symptom that endometriosis presents with. Apart from severe menstrual pain, women with endometriosis experience heavy menstrual bleeding, painful bowel movement, that is, when they want to poop, they experience painful bowel movement on their abdomen, bleeding in between periods, and pain during sexual intercourse. So if you fall under the category of women that have severe menstrual pain, you should go see your doctor. Number 5, bleeding between periods. Bleeding between periods simply means you're done with your 4 days of bleeding, or your 5 days of bleeding, or your 6 days of bleeding, or even your 3 days of bleeding. And before your next period, which is supposed to be on a certain date that you're aware of, you start to bleed again. And then on your next period, you still bleed again. So you're bleeding in between periods. This is a red flag. It could be due to birth control pills, infection of your cervix, infection of the lining of your womb, sexually transmitted diseases like chlamydia, fibroids, thyroid disease, and perimenopause as well. An additional danger sign you should look out for is missed period. If you are supposed to be seeing your period on a certain day and you miss that period, you don't see it that day or the next day or 2 days after that or even 3 days after that, that's a missed period. Look out for a missed period. It's a danger sign. It could be pregnancy, but it's not only pregnancy that causes you to miss your period. So of course, you do a pregnancy test to rule out pregnancy. So if you've confirmed that you're not pregnant, there could be other reasons for this. 1, stress, very low body weight, very high body weight, that's obesity, PCOS, birth control pill, primary ovarian insufficiency. What do I mean by primary ovarian insufficiency? It simply means when the ovary has stopped working or is not working the way that it is supposed to, and you are less than 40 years old. So some women have poor ovarian function at 30 years old. So we say the woman is having primary ovarian insufficiency. Because at 30, you should still be having a particular amount of eggs, but when you're evaluated, your eggs have reduced significantly. Your ovary is no longer functioning the way it's supposed to function, and you're less than 40 years old. So when you're having missed periods and you're 40 years or younger, it's a red flag. You should go see your doctor. If you found this video informative and you want more videos like this, subscribe to my channel, share with your friends, drop a comment in the comment section, and see you in my next video.